Hello, everybody, and thank you for listening to the Canterbury School Open Enrollment presentation. I understand Rick has opened it up, and I will go ahead and take it away. I hope everybody can hear me, and if you can, hold your questions until the end. We will open it up for a question and answer spot at the end of the presentation. This presentation is also being recorded, so you can watch it again later if you miss something. So this is your 2019-2020 open enrollment period. Your benefits will take effect on April 1st and run through March 31st for the benefits that you elect during this week. Your open enrollment does end on Friday, March 1st. So make sure that you get in there and make the elections that you want for your benefits for the upcoming plan year. This is our 17th annual ICUBA open enrollment. We are very excited to welcome 27 member institutions to the open enrollment period this year. So thank you for being part of ICUBA, and we hope you find this information helpful. So ICUBA tackles the biggest challenges when it comes to healthcare. We work really hard behind the scenes to get you the best access to the right time, providers, the right place, and the right care that you need to get you that really great access to health and well-being benefits. With this, we also want you to stay engaged. We want you to get engaged in the programs that we have, like Rally, to help you improve your health and well-being. We want to provide the highest quality care that is also safe and effective for the lowest cost possible to our members. Cost-effective benefits is something that's very important to us. And with this, we think it will provide better outcomes to all of our members. That improved health and well-being is our true focus. What you might not know is that ICUBA medical plans are self-funded. What this means is that all claims processed by the medical, pharmacy, behavioral health benefit providers they're actually paid not through those Blue Cross, Optum fronts. They're actually paid by ICUBA through your premium dollars. So ICUBA collects the premium dollars from you and from your institution. We collect them and we put them in this really large trust. And so the premium dollars are spent exclusively for your benefit on your insurance benefits, and they're used exclusively for the benefit of our members. Our plans are specifically designed by educators for educators. What you might not know is we meet 10 times a month in Orlando and really get together in a room and collaborate about how we can design the plans better to fit the needs of our population. ICUBA also invests in a long-term culture of well-being so you can be the best version of yourself. So with that self-funding in mind, to keep our costs low, ICUBA establishes programs and efficiencies to help mitigate some of those claims. When I was talking about access earlier, ICUBA really tries to break down the barriers to care by adapting our plans to provide quality and value. We do this through the $0 copayments for those Blue Distinction Total Care providers and those $5 teledoc visits, just to add a little bit of convenience to your life and give you the great access to those easy, low-cost benefits. We also provide low-cost prescription drugs that are not subject to the deductible. And we encourage everybody to get a biometric screening so you know where to start, like number-wise. We also have case managers and care consultants that are involved. We'll talk about these a little bit later, but they're calling you because they care. They want to assist, and they're actually partnering with ICUBA to help keep our costs and our claims dollars low. With this innovative approach and our willingness to invest in resources, we have programs like ICUBA Cares, Teledoc, Rally, and Resources for Living, that employee assistance program. We also have an exciting new benefit this year called Surgery Plus that we'll get into. So this year we have a call to action. Your health starts with you, and we need you to be a smart consumer. We want you to take advantage of the free preventive care services just to know your baseline. Also, register for Teledoc ahead of getting a sore throat or a sinus infection, because that's not the time that you want to, have to worry about fumbling around on your computer or with the app to get registered. So you can register anytime, and then when you need it, you can just use that benefit. If you're on some maintenance medications, you can call ICUBA Cares to see if they can lower your prescription costs. We've heard some really great things from them. We encourage everybody to use the 6 free EAP sessions. You can meet with a counselor and just get some free advice. Visit a dermatologist for preventive care skin cancer screening. That we live in Florida, it's bright and sunny all the time, and you don't know what's lying right underneath the top level of the skin. We also encourage you to use the Blue Cross Blue Shield pricing tools, and there's pricing tools on many of our brand partner portals. With those pricing tools, you can shop for the best price. For example, advanced imaging was changed to that $500 copay last year. But if your doctor tells you to go over to the hospital and get that advanced image, it's going to cost you a lot more than if you go and do a little bit of research and find an imaging center using those pricing tools. We also have features that you can win some money too. So if you're joining those city challenges and syncing your device, you could be entered to win $50. So get engaged and use your IQVIA benefits. We conducted an annual survey late last year, and we found that the number one concern from our members was the cost. Why are IQVIA's benefits so expensive? So we put together this comparison to show how IQVIA stacks up against the others. This shows the average annual cost of employee-only coverage across all of our member institutions. This illustration is adjusted for factors like demographics because IQVIA's population is fairly older than the standard population out there. It's also adjusted for location because Florida, you might not know, is one of the most expensive states to provide healthcare benefits in. And plan value. IQVIA's plan value is much richer than the other benefits out there. So in this illustration, you can see that even with the older population being in Florida and the richer plan design, our benefits are actually much cheaper than in the middle, you can see the education industry as a whole. And then on the far right, you can see everybody else. That's just a national benchmark. So enrolling in your benefits this week, you're going to visit IQVIAbenefits.org. And this enrollment is required to update your benefits for April 1st, 2019 to March 31st, 2020. These benefits that you elect during this week, they are required, I'll reiterate that, and they will remain in effect for the full plan year unless you have one of those qualified life events. So if you get married or have a baby or one of those other things this year, you will have 30 days to make changes to your benefits. So log into our website at IQVIAbenefits.org, and right at the top of your home screen, you can click Start Your Enrollment. Who is eligible for the benefits? Your legally recognized spouse, a natural child, a legally adopted child, stepchild, a child required to be covered by a qualified medical child support order, a child that you have legal guardianship over who also resides with you, and a foster child. IQVIA's benefits are unique in which we cover dependents that are the age 26 until the end of the year. So if you have a dependent that's turning 26 in January, February, or March, they're still eligible to be enrolled in the plan effective in April. We're just going to send you a reminder closer to the end of the year that they're going to have to move out of the nest and find their own insurance effective January 1st. We know that everybody reads the fine print before you click the final I agree button, but in case you missed this paragraph, you are agreeing and verifying that all the dependents you're covering under the IQVIA benefits plan are in fact yours. We are hosting an open enrollment sweepstakes this year. So if you log in at IQVIAbenefits.org, we're just asking that you confirm your personal phone number and personal email address. This is so that we can contact you if you're the winner. We're giving away a couple of $100 Amazon incentive gift cards this year. So just make sure that your phone number and email address are accurate when you're stepping through the enrollment. We want to remind everybody about the single sign-on section that's available at IQVIAbenefits.org. You do have access to all of our brand partners under the middle section where it says My Carrier Accounts. So you can access your MasterCard, the Blue Cross, Optum, and Aetna portals straight from your homepage. If you've never logged in before, a username and password may be required for your initial login, but the next time you go into IQVIAbenefits.org, you can click into any one of these carrier accounts without having to use that username or password. Through these single sign-ons, you can access lots of information, including ordering new ID cards, verifying your benefits, looking at how the benefits are paid and how they work. You can check out those explanation of benefits so you can know if you're paying the right thing when you go to the doctor. So if you've not been in there, get in there and check those out. So some medical plan perks offered to you through IQVIA's membership. We have a brand new benefit this year called Surgery Plus, which we'll go over. And we're just going to highlight some of the others that we think are perks, just so you remember them and are familiar with them. So Surgery Plus is brand new, and it will be effective on April 1st, 2019. Through our partnership with Surgery Plus, we bring to you the Surgeons of Excellence. This network comes with licensed, board-certified surgeons that have completed a fellowship, and they have proven lower complication rates. The contracting through Surgery Plus is a very strenuous process, and they really only take the best of the best into their Surgeons of Excellence network. Surgery Plus covers hundreds of medically necessary, non-emergent, but planned surgeries. There's a few items that are listed on the screen right here, but their list is really endless, as long as they're medically necessary and non-emergent, something that you can really plan out. With Surgery Plus, they come with their care advocates that will handle everything. They provide a full concierge service for a better member experience for you. If you contact Surgery Plus for one of those non-emergent but medically necessary surgeries that you can plan, Surgery Plus will waive your coinsurance and deductible. This will eliminate all out-of-pocket costs for your surgical procedure. I will caution you that this will not be a free service. For instance, if you need a knee replacement, the surgery itself will be free. However, prescription drugs that are needed will still go through Optum, and any physical therapy that's needed will still go through Blue Cross Blue Shield. But if you do contact Surgery Plus for that knee replacement, the coinsurance and deductible will be waived. So it is a very substantial savings. With this full concierge service that they provide, they'll locate the best fitting surgeon of excellence. What this means is they will find the 3 best surgeons that fit your needs. They'll provide you a short bio on the surgeons and allow you to choose which of the 3 you'd like to move forward with. If you would like your own doctor to be contracted, it will take a little bit longer. And again, there are very strict processes in place to make sure that your surgeon meets that surgeon of excellence. But they are open to accepting new members into their network. Once you choose one of the 3 surgeons that they provide to you, then they will schedule all appointments and manage logistics. They'll coordinate everything from start to finish, including record transfers from your current physician to your surgeon, and will do lots of follow-up to ensure member satisfaction. The average duration of the first call is approximately 4 minutes just to get you set up in their system, and the average time to procedure is about 35 days. So if you do call on April 1st for this benefit, it's not going to take too long before you can get in there and get the surgery that you need. This is just a reminder, Teladoc is still only a $5 copay. We do have a single sign-on available through My Health Toolkit, so if you've not already registered, please get in there and do so. The registration that you use for the first time through that single sign-on, you will be able to use then to log on to the mobile app. The mobile app is very user-friendly. This Teladoc is telemedicine and video consultations for only $5. 24 hours a day, 7 days a week, 365 days a year. The phone number is very simple, 1-800-TELEDOC. You would call Teladoc for more of the mild illnesses, like sinus problems, pink eye, allergies, nasal congestion, ear infection. So some of these more minor ailments. Something that you can really describe to a doctor over the phone, and they can go ahead and write you a prescription. You can be on your merry way. This is really convenient if you are at work and you feel like you're coming down with something, or if you're on vacation and you don't have access to your own doctor. This benefit is meant to supplement an ongoing relationship with a primary care physician or to be used as an alternative to urgent care. So you should really keep an ongoing relationship with your primary care, and there's a spot in the Teladoc website that you can share records with your PCP. IQVIA Care's Pharmacist Advocate Program. These are real pharmacists that will really advocate for you and provide real solutions. So they will actually, if you call for a prescription checkup, this is really the starting point. you're on a bunch of those maintenance medications, you can simply call for a prescription checkup. They'll evaluate your medications. If there is something that they feel like and you guys decide together that could be a prescription change, they can advocate for you and contact your doctor and the insurance company and get all that worked out for you. We do still have the preferred brand and non-preferred tier. There's a lot of confusion with our tier structure. So if you're confused and you want to make sure that you're taking the most cost-effective medications, you can give iCuba Cares a call and they can help you switch some of those around. Also, if you're in a situation with a prior authorization or step therapy or those quantity limits, a lot of times those are letters that are sent in the mail and they get discarded as junk mail. But if you're in a sticky situation where you are required to submit prior authorization once a year, iCuba Cares can really help advocate for you in that instance as well. iCuba Cares is open Monday through Friday from 9 a.m. to 5 p.m. And if you call for a prescription checkup and you are a candidate for the iCuba Cares Rally Incentive for qualified medication change, they can let you know at that point. The Blue Rewards Powered by Rally 2019-2020 Incentive Plan is not changing much from last year. Covered employees and covered spouses still have the ability to earn up to $250 Rally dollars that are redeemable in those electronic gift cards. But we have added a few coin incentives this year. The gatekeeper is still our Rally survey, so that's the first thing that you should do after April 1st. And if you haven't already done the Rally survey this year, you should probably go in and complete that survey so you do have access to the dollars that you earned so far this year. Starting next year, though, that Rally survey will be worth 400 coins. And we also have added a few things for teledoc registration, tobacco attestation, and clinical rewards. These are also going to be worth some coins this year. The clinical rewards targets chronic conditions. So being self-funded, we want you to know how to conquer your chronic condition. So if you have one of the chronic conditions listed on the screen right here, your Rally homepage is just going to look a little bit different. They've identified you with a condition and they've put you in a low, medium, or high risk bucket, and they're just going to provide you some educational materials based on your condition. It might be reading materials, it might encourage you to get a vision screening, or it might be a call with a health coach. So check that out, and if you meet all the criteria or all the goals that they set forth each quarter, you can earn 500 coins per quarter or 2,000 coins per year. The Rally sweepstakes were super popular last year, those private sweepstakes that iCuba offered. We're highlighting the most popular one here on the screen. The city challenges gave employees the ability to earn $50 Amazon incentives every 14 days. So every 14 days this past year, every 2 weeks, we did give away a $50 Amazon gift card. This will continue into the new year. So if you are walking, make sure that you're checking into those city challenges and syncing your device often. Private sweepstakes will also still be available for participation in the survey, challenges, and missions. We want you to get the care you need. I talked a lot earlier about breaking down access to or barriers to care. Primary care office visit, obviously, this should be your first stop for everyday health services, your annual checkup, your common illnesses, just health questions and disease management. In the yellow, this is kind of where you go on the go. This is teledoc, convenient care, which is the CVS Minute Clinic or the Take Care clinics at Walgreens or an urgent care clinic. This is for those more mild in nature items, sinus problems, bronchitis, ear infections, and this will cost you $5, $10, or $30 depending on the choice. We do want you to be mindful of emergency room pop-up clinics. They are made to look like urgent cares. So we encourage everybody to get onto the provider search tool and make sure that your local urgent care is in fact an urgent care and not an ER clinic. Because when you're expecting a $30 copay and they hit you with a $300 copay, you're not going to be very happy. In the red, we've highlighted the items that you should go to the emergency room for. These are life-threatening health problems, including chest pains, major traumas, severe burns, stuff like that. So really, if you are in one of these life-threatening situations, definitely seek out an emergency room in that situation. Health management and care consultants. These are our partners at Blue Cross Blue Shield, Aetna, IQBA Cares, and these people are calling to provide you with tools and education and to help advocate and help you manage your chronic health conditions. These are trained health advisors or registered nurses. So they're not just, a call center calling you. These are actually our partners calling to help you with goal setting, to help you better understand your doctor's treatment plan, and support you with referrals or transition of care. So when they call you, make sure that you at least give them 5 minutes of your day. It is proven that these health advisors and registered nurses can really help manage your situation and help you really significantly lower costs. Blue Cross Blue Shield Care Connected, this is their enhanced customer service. And that same member survey that we conducted last year, Blue Cross Blue Shield got some not poor, but more average remarks when it related to their customer service. And we weren't really happy with that. We'd like to see the satisfaction in the 90 percentile. So we shared that information with Blue Cross Blue Shield, and they upped their game, and they implemented what they call Care Connected. There's some technology behind the Care Connected. These are, it's a smaller group of people that are trained in IQBA's benefits, and it has a cool technology behind the scenes that if you call between 8 a.m. and 8 p.m. and your care advocate is available, the technology will route you to the same advocate. This is so if you're working on something with a care advocate, they can really help you through that process, and you don't have to re-explain yourself every time you call. So this new service is available with the same phone number on the back of your Blue Cross Blue Shield ID card. So we hope that it's more beneficial to you than last year. Blue Distinction Total Care. This is just a reminder that all Blue Distinction Total Care primary care physician visits are always free. So if you're doing medically necessary services at a family practice, internal medicine, or pediatric office, these will always be free. No copay, no coinsurance, no deductible. Canterbury offers the preferred PPO medical plan. We do want to highlight for you in blue, the deductible and out-of-pocket are going up by $500 for an individual or $1,000 for a family. So in the blue highlighted lines, you will see those increased deductibles and out-of-pockets. IQBA has not adjusted the deductibles or out-of-pockets for this plan ever. So we did some market research and we decided that it was time to bring them up to market standards. I'll get into a little bit more information in the coming slides on how this may or may not impact you. But the preferred PPO plan otherwise is staying exactly the same. It's built more on the copay or the coinsurance, structure. So 20% coinsurance for several of our services. We still have that up to $500 copay for that diagnostic imaging. Still the $300 copay for emergency rooms, but for the most part, it's the 20% coinsurance. So knowledge is power. Even though our deductible is going up, it's important that you know that the deductible does not apply to a lot of IQBA services. So if you're going for an annual checkup, chiropractic services, a common illness, you have somebody that needs hospice treatment, or you're visiting specialists like a dermatologist or a gastroenterologist, you require physical therapy or occupational therapy, prescription drugs, a spinal manipulation, all these services are not subject to the deductible. So even though the deductible is increasing, many of our services and most of our employees will not be impacted by that higher deductible. Where you should be alerted to where the deductible applies first. Our deductible only applies to major services. So if you have a hospital stay or you are receiving durable medical equipment, you need some skilled nursing rehab, home health, or surgeries that are not covered through Surgery Plus, these are the instances where the deductible would apply first. The prescription drug plan is not changing this year. So we still have that preferred and non-preferred tier structure that I was talking about earlier. What I will highlight on the screen for you is that a 90-day supply will save you money. So if you are on one of those maintenance medications and you do have the ability to get a 90-day supply, it is a 3-month supply for a 2-month cost. So I really encourage you to take advantage of that. IQVIA still offers several prescription drug freebies in the lower left corner. These are prescribed diabetic supplies, free to you, prescribed aspirin for adults, generic folic acid and generic prenatal vitamins for pregnancy, and if you're eligible, you can receive those prescribed generic statins. Optum did some member portal enhancements last year, so if you've not recently done the single sign-on through IQVIAbenefits.org, we encourage you to get in there and check out some of Optum's new member tools. You can still organize your mail order, you can manage your medications, you can find retail pharmacies, you can even receive text message reminders when it's time for you to take your medicine. So it's pretty cool, the features that they have implemented, so we encourage you to check it out. Behavioral health and substance abuse benefits are still provided through our partnership with Aetna. If you need to seek professional counseling, receive a psychiatric medication evaluation, you're dealing with some applied behavioral therapy, those are the ABA services, including autism spectrum disorder, or intensive services, including hospitalization or residential treatment. These benefits are all offered through our partnership with Aetna. Also with Aetna, we have the condition management program. These are free weekly sessions. So over the course of 8 weeks, you'll meet twice a week, once with a therapist and once with a behavior coach. These can be web-based over video conferencing or telephone, and they tackle the challenges found on the left. These health and life challenges, including heart problems, digestive health, pain management, postpartum depression. So if you have any of these conditions, these therapists and behavioral coach will actually get on the phone with you and help you identify health goals and come up with an action plan. We've heard some really great success stories from this program, and the items that you learn over the 8 weeks are meant to reshape and really help you reconstruct how you're living your day-to-day. Aetna also is over all of our emotional well-being, and they provide our employee assistance program. So it's the same phone number on the back of your ID card. Option 1 will be for the EAP, and option 2 will be for the behavioral health. They also have a lot of great apps out there just to help you, at a moment's notice with your phone in your hand, really help you tap into that emotional side of your well-being. The employee assistance program should be your first stop for, especially for any counseling needs that you have. They provide support for emotional, life, legal, and financial. This is available to everyone at Canterbury. You do not need to be enrolled in IQVIA's benefits. You just simply need to be an employee of Canterbury School. So with this benefit, you gain 6 sessions per issue per year. They are free and confidential. So if your students are driving you crazy, you can call and have 6 sessions about that, and you want to have a little bit of legal counseling, 6 more sessions for that. So it's really 6 sessions per issue per year. With tax season coming up, I know a lot of people are, worried about filing their taxes. That's another thing that they do. So if you are really struggling with any life situation, the EAP is like your own personal concierge or personal assistant. Nobody will say no to a free personal assistant. The EAP is also going digital. They've partnered with a company called Talkspace, so now you can text a therapist. This online therapy platform makes mental health care more convenient and accessible. Everybody's very busy nowadays, and sometimes it's just easier to text a message and then wait for a response. On average, 1 week of Talkspace messaging is equal to 1 EAP session. This is unlimited multimedia messaging, including text, audio, pictures, video, or emails through a web browser. You can do it through the web browser or the Talkspace mobile app. I will caution you that this is not the instant satisfaction or gratification that you're going to get from text messaging a friend. The therapist does have 1 working day to respond to you. However, it is very convenient for people that are on the go, that don't have time to sit down and really talk to somebody on the phone, and maybe it's just something that you feel more comfortable emailing about. You will need to call Resources for Living first and foremost for the authorization. So step 1 is calling off the calling Resources for Living, and then from there they will talk you through how to register for Talkspace and really get you going on that. This is only available for adults 18 and older and non-California residents only. The HRA is funded through Canterbury. This is funded by your employer at the end of each month. So with participation in IQBA's medical plan, Canterbury will automatically put funds onto that IQBA MasterCard at the end of each month for you. After 36 months of participation in an IQBA medical plan, you're called you're considered vested, and the funds are yours to keep should you ever leave the institution. These funds can only be used for eligible healthcare expenses incurred by the employee or covered dependents on the IQBA medical plan. These funds will roll over at the end of each year, and they will accumulate in that account for you, and these funds earn interest quarterly. The healthcare flexible spending account, this is employee money. So these are pre-tax dollars from you as opposed to Canterbury. This has a maximum annual limit of $2,700, so increasing slightly from last year. You do not need to be enrolled in IQBA's medical plan to elect the FSA, and your entire election is pre-funded and available to you on April 1st. So whichever dollar amount that you choose will be available to you up front, and then will be taken in small, even contributions from your paychecks. These funds are subject to the use it or lose it rule, so I would encourage you to plan wisely for this. If you do elect the full amount will be available to you, but then it's important for you to really use those dollars, because if you don't, they will be gone. These are for eligible healthcare expenses incurred by the employee and taxable dependents, and these can be accessed using your benefits MasterCard. This enrollment is required each year. We just want to let you know, we are ACA compliant. The preferred PPO plan is equivalent to a gold plan on the Marketplace Exchange. Our plans offer lower out-of-pocket costs with broader networks, and we offer a lot more free wellness benefits that are required by law. Your 1095 tax form will be available to you in your employee file if it is not already at icubabenefits.org. This tax form is not required this year, but we just have it out there just in case you need it. But all requirements of healthcare reform are in place. We have several mobile apps that we've talked on and touched on throughout this presentation. So these are all of our mobile apps just in one slide. New this year, we do have the Blue Cross Blue Shield mobile app. Previously, that was just a mobile responsive website. So I would encourage all of you to get in and download the My Health Toolkit app. It is available in your app store. And this, you can check the status of your claims, view benefits information, and have your ID card right on your phone whenever you need it. It's very easy, very user-friendly, and it's just a great resource to have in your pocket. So that is all that I have. Thank you for your attention. We're really excited about this coming year, and that's all. Thank you.